Hello and welcome to another episode of What's Your Why Wednesday. I'm Andrew Gofrak, our Chief Executive Officer, and today joining me is Jennifer Steffler from our Emergency Department. Jennifer, welcome.
Thank you. Thank you for having me.
Of course. I'd love to, maybe we'll get started by just telling us a little bit about you, what you do at Arrowhead, as well as how long you've been here.
Of course. I have been here at Arrowhead for 19 years. I graduated nursing school in 2007 and have been in the emergency room at Arrowhead as a registered nurse ever since. But my journey with Arrowhead started before I was a nurse. When I was 17, I was in a pretty bad car accident, and I was actually brought here as a trauma patient to Arrowhead. My parents weren't given a very good prognosis, said that if I survived my injuries, I would never walk again because I was paralyzed. I broke my back. But because of the amazing team here, I survived my injuries, and it was the nursing staff that really stuck out to me during my stay here, that really made a difference to me. Just the small things of, spending time with me and holding my hand, that really made a difference and really inspired me to go into nursing school and ultimately do what they did.
That's so powerful, right? Mm-hmm. Having that very personal experience and then being able to make a career out of that, right? Mm-hmm. Not too many people really kind of have that true personal connection. So thank you. I really appreciate you sharing that. And I know now you're also a preceptor for our new nurses, and yep. I'd love to maybe hear a little bit about how you take your experiences and carry that forward and how you teach our new grads. Mm-hmm.
So working as a emergency room nurse, I feel like, especially with our population here, we have so much opportunity to make a difference, whether it's just the small things of, like when I was in the hospital, sitting down and holding my hand during a difficult procedure, comforting families when they're getting bad news, just sitting and spending time with your patient, going through and just doing the extra move really makes a difference, makes them feel safe, makes them feel valued, makes them feel heard. So I really tried to teach my new grads, to go above, just take those extra moments. It doesn't take much, because those are actually the moments that are going to really stick out to your patients and really make a difference.
Yeah, it's amazing when you think about the nursing practice, right?
Yeah.
It's so much of it is clinical and technical, but also so much of it is compassion, mm-hmm. and just taking that extra few moments, holding that patient's hand, walking them through the process, and just letting them know we've got you, mm-hmm. right? When you look at our mission at Arrowhead and the patients we serve, how do you kind of relate back to those, the patients that we're serving versus how not only you're teaching our new students, but also just from your own experiences, to really make sure that regardless of who comes through those doors, they're receiving excellent quality care? Yeah,
so not only do we give good quality care here, but we want our patients to know, and that's what I teach, that we're going to be their advocate. Some people who aren't in the condition to even speak up for themselves, we become their voice. We want them to feel heard, we want them to feel safe, supported, and that we're going to do whatever we can to get them feeling better. They come into here for whatever reason it's at their worst. Just like when I was a patient here, I was at my worst. And it was those small moments that really gave me that extra drive that, I'm safe, I'm going to get better, and I think I really try to use that to tell my patients, like, we care for you, we're here for you, and you're safe.
That's incredible. And I know your husband's also in public service, he's in law enforcement, and you mentioned that your youngest daughter is looking at nursing as well, mm-hmm. right? So do you think a lot of why she's into that is kind of rubbed off from how you present yourself and what you do every day? Yes,
she always asks questions about what do I do here at the hospital. She loves nursing, she wants to become a nurse. Anytime I have to come here on my day off, she wants to come here. She wants to meet the nurses, she wants to meet the doctors, she's asking questions. She just loves, and I tell her she's got a heart of gold. So she's already got the heart for it.
That's great.
So I know she's going to be amazing, and she's going to fill into my shoes.
Well, maybe we'll have your daughter here at some point, working side by side with you, which would be wonderful. Well, I really appreciate you taking the time this morning and sitting down and talking and sharing your why. It is such a powerful story, so I really do appreciate that. Thank you.
Thank you for having me.
Thank you. And this is another edition of What's Your Why Wednesday. Thank you very much, and stay tuned for next episode next month.